Big pharmaceutical. They have got their hands out, and their prices are going through the roof. There's a group called, we talked last month with a group called Americans for Pharma Reform, Americans for Pharma Reform, and they're online at bustbigpharma.com. There was a bus that traveled the country in some of the battlegrounds and some of the more important areas where Senate races were being held. Montana, Wisconsin, it went to Michigan, Ohio, it finished in Pennsylvania. And I want to welcome Rob Burgess, the executive director of Americans for Pharma Reform, back to talk about the impact that this issue might have on voters in those battleground states. Rob, good morning. Good to have you. How are you?
Thanks for having me back, Bob.
Yeah, absolutely. So let's remind everybody about the origin of Americans for Pharma Reform.
Sure. No, Americans for Pharma Reform is a nonprofit group of concerned Americans that are sick and tired of the detrimental and predatory practices of Big Pharma. For too long, Big Pharma has been charging the American people 2 to 6 times more for the same prescription drugs than the rest of the world. And we are sick and tired of it, and we wanted to educate the American people about what was happening.
Yeah, and it's important because, we're an aging population. The boomers and the Gen Xers are all getting up there to the point where, more medications are needed and higher drug prices are taking a massive, massive bite out of the average American family's budget. There's just no getting around it. So somebody needs to address it. Tell me about some of your efforts.
No, you're absolutely right. And we're so glad to be in the midst of our Bust Big Pharma bus tour. You were just talking about the states that we've been. We're still in Pennsylvania right now. We had a great time there in Ohio, talking with so many Buckeyes across the state. But we are talking about the education part of this, right? The American people know that their prescription drugs are high, but they don't know why. And we're educating them about how a lot of our existing politicians, Kamala Harris, has taken $3 million from Big Pharma in the last 8 years. Sherrod Brown has taken $1.4 million from Big Pharma in the last 6 years, right? Including $500,000 from the pharmaceutical companies that are directly responsible for the opioid crisis in this country. And so we really have to educate people that these politicians are telling us one thing at home, but they're going to D.C. and they're doing or saying something else. And we deserve better than just receiving lip service from our elected officials. And we're really trying to make sure that everybody's as informed as they can be before they step into the ballot box, whether that's on Election Day or, as you were just talking about, Bob, voting early as quickly as they can.
We're talking to Rob Burgess, Executive Director of Americans for Pharma Reform. You're talking about supporting certain candidates that obviously are pushing back against this and are trying to enact price controls and trying to stop Big Pharma from having the power and the hold that they seem to have over so many. Can you speak to what efforts are being undertaken in order to do that? And I'm talking about how are you supporting candidates? You're bringing the big bus through, you're educating people, but how else are you supporting candidates that elected officials that will stand up to the big pharmaceutical companies?
Absolutely. The bus is a great billboard for our cause, right? But we're also engaging directly in our communities as well, right? When we were in Wisconsin, we had the opportunity to hold a town hall meeting with the Republican Senate candidate, Eric Huffkey, with Republican Senator Tom Cotton from Arkansas and Republican Congressman Tom Tiffany in Wisconsin. And that room overflowed, Bob. We thought we were going to have 100 people there. We had close to 250 people show up for this town hall. We spilled out of the ballroom into the hallway and into the lobby of the hotel we were in. And we spent probably 3.5 hours answering questions and taking photos and having people sign the bus. And ultimately, what it came down to was people know that this is an issue that does not end on November 5th, that this is an issue that's going to continue on November 6th, on November 7th, on November 8th. And they're so excited that there's a group like Americans for Pharma Reform that's already standing up and it's ready to pick up that flag and carry it forward into this fight as far into the future as we have to go until we have real reform on this issue. And so we're doing town halls. And then in addition to that, Bob, we're dropping radio ads. Today we just dropped a radio ad in the Madison, Wisconsin market highlighting Tammy Baldwin, liberal Senator Tammy Baldwin's hypocrisy on this issue. And we're looking to do that in other markets across the country, highlighting those lip service politicians that are not actually fighting for the constituents they represent.
You mean people like Sherrod Brown?
I'm talking about people like Sherrod Brown, who tells us one thing at home and then absolutely goes to Washington and forgets the people who sent him there.
Yeah, that's exactly what I'm talking about, too, and that's why this is so important to me. And I don't care which issue it is, any issue, because there are so many of them that are crucial for American families and just for American citizens. Immigration is an issue. Obviously, inflation is an issue. Wages are an issue. But the drug prices, again, I don't know how many people realize how important this is and how much of a bite it can take, as I said in the open, out of an average family's budget. And if somebody isn't out there fighting for them, we are all just going to continue to watch that rise because there seems to be no check and no balance on big pharma. There's, the medical industrial complex as a whole just has a hold on far too many of these elected officials. And if we don't remove them and replace them, there's going to be nothing. And you're right, by the way. This isn't something that can be just solved on November 5th. This is going to continue, and we need to continue rooting out those who allow it to happen, those who may be on the payroll one way or another from some of these big pharmaceutical companies that seem to have unchecked power.
You're absolutely right. And you just mentioned a big issue that Washington has, and it's that revolving door between the bureaucracy of the federal government and big pharma itself. And you actually don't have to look any further than Sherrod Brown's own office to find that revolving door. His former chief of staff and his former legislative director left his office and became lobbyists for the pharma industry. Well, that tells you something right there.
Yes, it does. Yes, it does. So tell me, how many more stops do you have on the tour in Pennsylvania?
So we've got 3 stops today across central Pennsylvania. We're very excited about that. And then we will be booking ourselves up to New York City because we heard that President Trump is holding a rally in Madison Square Garden. And New York is one of those states that part of it's going to be in play. And we believe that New York needs to be educated on this issue as well. And so we're going to take our bus up into Manhattan, and we are going to drive around downtown Manhattan for 8 hours as a mobile billboard on the day that Donald Trump has his rally in New York City. And then we're going to start working our way south down the East Coast. We're going to hit Philadelphia. We're going to hit Washington, D.C. We're going to hit the great state of North Carolina, where, once again, it's a swing state that you were talking about that's on the map this year, and we need to make sure that we make some changes down there. And then we're ultimately going to end down in Central Florida, hopefully having a town hall in the Villages area with a ton of senior citizens that are very passionate about this issue and are looking for answers. And that's where we're hoping to end on Election Day.
I love that. I love that message, and I love that fact that you're going up there to New York in the belly of the left-wing beast, if you will, in Manhattan, because you're driving us around and you're getting attention, and I love that. Let me ask you, are you getting negative attention? Is anybody coming up to you guys, seeing your bus and saying, screw you, you're just partisan, conservatives or what have you? Does anybody attack you guys verbally for the messaging you're trying to spread?
I've got to tell you, Bob, we've been on the road for almost 14 weeks. We have not had one negative interaction on the road. We've had almost 15,000 people stand the side of the bus. I would say at least 3,000 of those are dyed-in-the-wool Democrats and liberals. This is an issue that crosses party lines. 81% of Americans tell us that this is an issue that they're extremely concerned about. Specifically, when we start talking about Ohio, 73% of Ohioans say that this is an issue that needs to be reformed. And when you ask them who's to blame, 78% of Ohioans say it's Big Pharma, right? So this is not a Republican or a Democrat issue. This is an American issue. And that's why we're being so well received. And
it should be.
Donald Trump's going to be.
It should be an American issue, but it is also a Democrat and Republican issue because of what you are saying right now. You're naming the names of the individuals who are responsible for giving Big Pharma this power, and most of them are on the political left. Most of them are Democrats, and most people who are Democrats don't want to hear any criticism of that. So I'm glad to hear you say that they, all of the positive interactions you're having with 15,000 people signing the bus and so on and so forth, and I'm glad there are Republicans and Democrats. But what I want to know is, are those individuals ready and willing to do anything about it and remove the people responsible for this big pharmaceutical fraud?
And you're exactly right. And that's the challenge that we offer them when they're at the bus. And we give this education to them, right, is that they have the power. They have the power with their pocketbook. They have the power with their vote. And they have the power with their voice. to go ahead and make sure that we start instituting changes now. And a lot of it comes from education, and it's from people like you, Bob, with this show, reaching thousands and thousands of people who might not have seen the bus, who might not have heard our radio ads, who might not have seen our digital ads on Facebook, but they're getting to hear this message now because you're giving it a platform. And ultimately, that's why this issue, like you said, it's not going to end on Election Day. This issue is going to continue into the next Congress. And we need as many of Americans to go to AmericansForPharmaReform.com, AmericansForPharmaReform.com, and sign up to get updates, so that we can tell you exactly what's happening in your local community and which of your politicians are standing up for you and which of them are giving you lip service.
I want to clarify something. Rob Burgess, Executive Director of Americans for Pharma Reform. Is AmericansForPharmaReform.com the same link as BustBigPharma.com?
It will get you to the same organization, 100%. Bust Big Pharma is about our bus tour, but we link to our homepage as well from there. So you can go to either website and get information on our group.
Yeah, I just wanted to make sure of that because I've been promoting the BustBigPharma.com. Just for people who don't know, bust,
sure.
not bus, but BustBigPharma.com. And then obviously AmericansForPharmaReform.com. And people can sign the bus, right? They can do it virtually on the website.
They absolutely can do it virtually on the website. I need to get an updated count from our web team to see how many virtual signatures we have. But we are also putting a mileage counter on our website. We're updating that every day. We're proud to have crossed just over 10,000 miles in the last 14 weeks. And all of our projections look like we're going to cross 15,000 miles by Election Day. And so we are out here hustling. We're trying to reach as many people as possible. And, yes, if you aren't able to be at one of our events, you can sign the bus virtually on our website.
Great stuff. Everybody's got to play a part, whatever their role is, and find it, figure it out, and play it to the best of your ability. Because, like I said, we're in a grave position right now as far as the future of this country and whether or not it's going to be able to survive as it currently exists. And we need to be able to control that which is controllable. And elected officials can control those drug prices, can help us stay healthy, and can help the American people do what we need to do to survive and to thrive without breaking our banks. It is extraordinarily important. So Rob Burgess and Americans for Pharma Reform, thank you for what you're doing. Keep up the great work. Enjoy the rest of this tour and this trip to New York and back down through Philly and everywhere else. It's so extraordinarily important what you're doing. So keep getting that message out there.
Thank you so much for having me, Bob.
You got it. It's a pleasure. There you go. That's Americans for Pharma Reform. And go to that website to sign the bus virtually. It's bustbigpharma.com, bustbigpharma.com.